Well, nurses here in the district have gathered today to really protest and call attention to what they're calling insufficient protection of health workers who have to care for Ebola patients. Now, these nurses have been here since 7 a.m. this morning. They're planning to stay well into the evening because they say this is a critical issue and it needs to be paid more attention.
Our nurses have called us on the quiet because they're afraid for their jobs to say, I've not been taught anything. I've not been given the equipment. We don't know what the equipment looks like. We have no idea what the hospital plans for us to do if anyone comes in our doors with Ebola.
We have not received any training. We have not seen any hazmat suits. We have not received a basic even show how. We were handed out a CDC printout from the website, which is very sad, and told to read it.
We need to be protected in the right way. We need gowns, hazmat gowns. We need the right equipment, period, to protect our patients.
The organizers of the protest here today is a nurses union called National Nurses United, and they really say that hospitals still lack a lot of the basic essentials they need in order to prepare their nurses to deal with this Ebola epidemic. That includes training. It also includes enough hazardous material suits that can cover the nurses' exposed skin. The protest also stems from another issue, and that is the issue of quarantining for these nurses should they come into close contact with the virus. The very unclear point is whether nurses would be paid for that time off, for that 21-day incubation period, whether they would be paid for that time off. And of course, they believe that they should be paid considering the risk involved. But those are small details that have yet to be worked out in contracts with the hospital. Now, we've, of course, already seen a number of healthcare workers now infected and treated with Ebola in the United States. So this is a very real issue, and it became much more real after seeing the two nurses who had to be treated for Ebola after contracting it in Dallas from the first U.S. Ebola patient, Thomas Eric Duncan.
The nurses down in Texas, they didn't get the training. And when that nurse in Dallas came down with Ebola, they threw her under the bus and basically said it was her fault. And it wasn't. That hospital wasn't prepared. And they finally spoke up and said, what guidelines, what training? There was no protocol in place.
And that concern is not only shared by nurses in the district here in D.C., but also across the country and across the world. In fact, tens of thousands of nurses are reportedly doing the same thing today, are protesting for Ebola and for safe practices in the hospital. They're protesting in a dozen different U.S. states, also several countries, including Australia and the Philippines. Now, I've reached out to Providence Hospital for comment on this particular protest and the issues that these nurses have really raised today. I've yet to hear comment back about that, but I can tell you that this issue of health workers protection is just beginning. It's not going away anytime soon, especially considering the uptick we've seen in the last few months of Ebola patients here in the U.S. In Washington, Amira David, RT.